Good morning, my name is Shaina from BSN 1B. I'm going to be giving an oral presentation for the objectives for the assessment of the thorax and lungs. So the first thing you want to do is you want to prepare your equipment. Then you want to do your hand hygiene. You want to give courtesy to the patient, introduce yourself, and give privacy to the patient so that the patient can change into his or her gown. Also, by doing this, you want to keep your hands warm. The first thing you want to do is the general inspection, where you inspect for any nasal flaring and pursed lip breathing. Then you want to observe the color of the face, lips, and chest. Then you want to inspect the color and shape of the nails. Then we're going to move on to the posterior thorax, wherein we're going to inspect configuration. This is where the client will sit with his arms at the sides, stand behind the client, and observe the position of the scapulae and the shape and configuration of the chest wall. You want to observe the patient while he's sitting down and see if it's in the right position. If it's not, you want to document any findings. Then after that, you want to observe using accessory muscles. You want to watch the client breathe and note any use of muscles. Then you want to inspect the client's positioning. You want to note the client's posture, the ability to support his own weight while he's breathing comfortably. So you want to see how he's leaning or what his position is when he's breathing. Then we want to go to palpation. You want to palpate for tenderness and sensation. You want to palpate, using one or two hands, but a sequence of palpation already established. You want to use your fingers to palpate for any tenderness, warmth, pain, or other sensations. You are going to start from the midline at the level of the left scapula and move your hand left to right. You want to compare the findings bilaterally. Note any findings. Then you want to palpate for crepitus. Crepitus, also called subcutaneous emphysema. It is a crackling sensation like bones or hairs rubbing against each other. You want to check for that also using your fingers. And then you want to palpate surface characteristics. You want to use gloves while doing this so you can inspect any lesions or any blisters or any types of external abnormalities or injuries. And then you want to palpate for firmitas. You want to use the following sequence as described previously. You want to use a ball or a ulnar edge of one hand to assess for firmitas or any vibrations of the air in the bronchial tubes transmitted to the chest wall. So as you move your hand to each area, you want to ask the client to say 99 and assess areas for any symmetry or vibration. Then you want to assess chest expansion. You want to place your hands on the posterior chest wall with your thumb at the level of T9 or T10 at the spine, the back, and then it's like a butterfly shape. Then you want to be pressing together a small skin fold, and then you want to observe the movement of your thumbs as the client takes a breath. Then for percussion, you want to percuss for sounds, tones. You want to go across on top of both shoulders, and then you want to percuss intercostal spaces across and down. You want to compare sides using indirect and mediate percussion. You also want to percuss to the lateral aspects at the bases of the lungs and compare sides. You want to note areas of renaissance, hyperrenaissance, or any dullness. Then percuss for any diaphragmatic excursion. You want to have the patient take a deep breath and fully exhale, then percuss a level diaphragm and mark. You want to see where it extends and then mark, and then you want to measure the distance between the two marks. And now for osculation. This is where you're going to be using your stethoscope to listen for the sounds inside the patient's lungs. You want to hear for any cracklings, any deep breathing, any rusty sounds, coarse sounds, any rubs, wheezes. And then you want to test for abnormal voice sound. You want to oscillate if there's like sound like random sounds, like random sounds like or e that doesn't sound right. Usually you want to look for a sound that is not normal. You can also oscillate for sounds by having the patient speak some numbers or recite some terms like ABC or 1, 2, 3, and you want to listen how it sounds inside. And then now for the anterior thorax, you want to inspect the shape, the configuration. You want to have the client sit with arms at the sides, stand in front of the client and assess the shape and configuration. This is to determine the ratio of anterior-posterior diameter to transverse diameter, costal angle, spinal deformity, and the condition of the skin. And then after that, you want to inspect the position for sternum from the anterior and lateral viewpoints. After that, you want to watch for stemal retractions. You also want to inspect for the slope of the ribs from anterior and lateral viewpoints. After that, you want to inspect for quality and pattern of respiration. You want to note the breathing characteristics, rate, rhythm, and depth. And then you want to inspect the intercostal spaces while the client breathes normally. Then you also want to inspect for use of accessory muscles when the client breathes normally. And then for palpation, you also want, just like I mentioned in the beginning, you want to palpate for tenderness, sensations, surface masses, lesions using your gloves. You want to palpate for firmness by using the ball, palpate for chest expansion, and then for percussion, you want to percuss the spices for tone above the clavicles and then the intercostal spaces again. So you're just like putting the stethoscope around. You want to hear for any abnormalities or any unnormal sounds. And then same goes for the osculation, the breathing sounds, the adventitious sounds, the voice sounds, and all types of different sounds. So that is how you assess the thorax and lungs.